Prostate cancer, a disease affecting the lives of many men. This video will delve into the complexities of this condition, exploring its causes, symptoms, diagnosis, treatment, and what the future holds. We aim to provide comprehensive information to increase awareness and understanding. The exact cause of prostate cancer remains elusive, but several factors increase a man's risk. Age is a primary factor, with the risk increasing significantly after age 50. Family history also plays a crucial role. Having a father or brother with prostate cancer more than doubles your risk. Genetics also plays a role. Genes such as BRCA1 and BRCA2 mutations, known for their association with breast and ovarian cancer, may also increase the risk of prostate cancer. Lifestyle factors like diet, obesity, and lack of exercise have also been linked to an increased risk, although the precise mechanisms are still under investigation. Finally, race is a factor, with African American men having a higher risk of developing the disease and often experiencing more aggressive forms. Prostate cancer begins when cells in the prostate gland, a walnut-sized gland located below the bladder and in front of the rectum, start to grow uncontrollably. This abnormal growth often begins in the gland cells that produce prostate fluid, known as adenocarcinoma. As these cancerous cells multiply, they can form a tumor that may eventually spread beyond the prostate gland. The process of metastasis, or spread, typically involves cancer cells breaking away from the primary tumor and traveling through the bloodstream or lymphatic system to other parts of the body, such as the bones, lymph nodes, liver, or lungs, where they can form new tumors. Prostate cancer is a significant health concern worldwide, representing the second most common cancer among men, following skin cancer. Incidence rates vary across different regions and ethnic groups. In the United States, it is the most frequently diagnosed cancer in men, excluding skin cancers. Globally, the highest rates are observed in North America, Australia, and Europe. Understanding the epidemiological patterns of prostate cancer is crucial for developing effective screening programs and resource allocation strategies. In its early stages, prostate cancer often presents with no noticeable symptoms. As the cancer progresses, symptoms may include frequent urination, especially at night, difficulty starting or stopping urination, a weak or interrupted urine stream, painful urination, blood in the urine or semen, and erectile dysfunction. Advanced prostate cancer can cause bone pain, especially in the hips and back, as well as leg weakness or numbness. It's important to note that these symptoms can also be caused by other conditions, such as benign prostatic hyperplasia, a PH, or an enlarged prostate. Therefore, it is crucial to consult a doctor for proper diagnosis. Diagnosing prostate cancer typically involves a combination of tests. A digital rectal exam, or DRE, allows a doctor to physically examine the prostate gland for any abnormalities. A prostate-specific antigen, or PSA, blood test measures the level of PSA, a protein produced by the prostate gland. Elevated PSA levels may indicate prostate cancer, but can also be due to other conditions. If either the DRE or PSA test results are abnormal, a prostate biopsy may be performed. During a biopsy, a small tissue sample is taken from the prostate gland and examined under a microscope to determine if cancer cells are present. If cancer is found, imaging tests such as MRI or bone scans may be used to determine the extent of the cancer or stage. Prostate cancer can be classified based on its Gleason score and stage. The Gleason score is a system used to grade the aggressiveness of the cancer cells. It ranges from 6 to 10, with higher scores indicating more aggressive cancer. Staging describes the extent of the cancer's spread. It ranges from stage I, where the cancer is small and confined to the prostate, to stage IV, where the cancer has spread to distant parts of the body. Additionally, prostate cancer can be classified based on whether it is hormone-sensitive or hormone-resistant, which affects treatment options. Treatment options for prostate cancer vary depending on the stage, Gleason score, and the patient's overall health and preferences. Active surveillance involves closely monitoring the cancer without immediate treatment, typically used for slow-growing cancers. Surgery, specifically radical prostatectomy, involves removing the entire prostate gland. Radiation therapy uses high-energy rays to kill cancer cells. Hormone therapy, also known as androgen deprivation therapy, reduces the levels of male hormones in the body, which can slow the growth of cancer cells. Chemotherapy uses drugs to kill cancer cells throughout the body, typically used for advanced prostate cancer. Immunotherapy uses the body's own immune system to fight cancer. Emerging therapies such as targeted therapy and clinical trials are also becoming increasingly important. Management often involves a multidisciplinary team of doctors, including urologists, radiation oncologists, and medical oncologists. While there's no guaranteed way to prevent prostate cancer, certain lifestyle modifications may reduce your risk. Maintaining a healthy weight through diet and exercise is crucial. A diet rich in fruits, vegetables, and whole grains, while limiting red meat and processed foods, is recommended. Regular physical activity has been linked to a lower risk of prostate cancer. Some studies suggest that consuming lycopene, an antioxidant found in tomatoes, and selenium, a mineral found in Brazil nuts and other foods, may have protective effects, but more research is needed. Screening guidelines vary, but early detection through PSA testing and DRE can help identify prostate cancer at an earlier, more treatable stage. Consult with your doctor to determine the best screening schedule for you. The prognosis for prostate cancer varies widely depending on the stage at diagnosis, Gleason score, and treatment received. When detected early and confined to the prostate, the 5-year survival rate is nearly 100%. However, the survival rate decreases as the cancer spreads to other parts of the body. Recent research focuses on developing more targeted therapies that specifically attack cancer cells while sparing healthy cells. Immunotherapy has shown promise in treating advanced prostate cancer. Genetic testing is becoming increasingly important for identifying individuals at higher risk and tailoring treatment plans. New imaging techniques are improving the accuracy of diagnosis and monitoring treatment response. Ongoing clinical trials are exploring novel approaches to prevent, treat, and ultimately cure prostate cancer.